Oh, there we go. Welcome, Dr. Kacie Wells, and welcome everyone. We just went into recording mode. We are so glad that you're here. If you are joining us for the very first time as a webinar participant, we're so glad that you're here. Very brief introduction to BirchBark Foundation. My name is Megan French. I'm our executive director. BirchBark Foundation provides three main services to the community: pet aid funding, grief support services for anyone in California, and our webinar series. We do quarterly webinars. We are so excited for this panel. This has been a long time coming. We have had this idea for a long time. To get 4 practicing veterinarians at one place at one time has been a feat of nature, and we are so glad to bring them to you today. You guys have written in some questions. We are going to put them to our veterinarians. Before I pass them off, we are so grateful to have Dr. Katie O'Hearn from Blue Pearl, Dr. Jeff Fankhauser from Pet Maintenance and Repair, Dr. Kacie Wells, thank you so much, from Westside Animal Hospital, and our very own founder. I'm so sorry, did I say that wrong?
Yes,
Harbor. Harbor.
Oh, I'm so sorry, we've had that wrong. Thank you, Harbor. Harbor, thanks. Correction there. And our very own founder and passport president, Dr. Merrianne Burtch. Our webinars are free to the public. We're really excited to offer this as free programming. If you would like to make a donation to continue helping our programs moving forward, you can just visit our website to do that, www.birchbarkfoundation.org. And if you'd like to sign up for our newsletter to make sure that you have more information on getting notices of these in the future, you can scroll down to the very front page there and sign up for our newsletter. I'm going to go ahead, mute myself, hand this over to Dr. Burtch, and I'm really thrilled for the next hour. Thank you all so much for being here.
thank you so much, Megan. And welcome everyone. I'm going to have everyone introduce themselves, but do a little ground rules. Many of you who've asked questions, some of them are a little bit specific, and we come from very different backgrounds, which we tried to get some diversity in our presentation, but we have quite a few questions. We may not get through all of them. We're going to pose them in the order that we receive them for the webinar. But I want to take just a minute for everyone to introduce themselves and what their background is. So Dr. O'Hearn.
Hi, good evening. My name is Dr. Katie O'Hearn. I am an emergency room veterinarian, and I am the medical director at Blue Pearl Monterey. I have also done some work in general practice, urgent care, and other emergency facilities throughout the Bay Area, and I'm very happy to join you this evening.
Thank you. Dr. Jeff.
General practitioner right now. Most of my career I've worked in shelter medicine, and pretty much the rest of the career I worked sort of in the low-cost, high-volume side of the profession. Currently, I own a veterinary practice in Prunedale, and serve on the board of BirchBark and do a whole lot of work with BirchBark. They empower me to help a lot more people than I could otherwise.
Thank you. And Dr. Wells.
Yes, I am a fairly new small animal vet. I was a horse vet for many years and converted about 7 years ago. And I work in general practice, and I also am an at-home euthanasia doctor on the side. But I work in a very busy small animal dog and cat practice in Santa Cruz. And I'm really glad that I'm not doing horses anymore. It's a better lifestyle.
Great. Thank you so much. And I'm Dr. Merrianne Burtch. Many of you know I'm an internal medicine specialist. So each of us have a very unique thing to bring to the group, and I'm excited about having the variety. And I'm going to kind of direct questions according to what everyone's background is. I told everyone I promised that I wouldn't give them questions about diabetes. That's my area of expertise. So our first question is, my 10-pound dog sometimes has stools that are bright yellow and have bile in them. Should I be concerned about this, and should he be taken to an internist? And he's otherwise healthy, clean teeth, etc. Well, as an internist, I can answer that question. So that's a good question. There is times that the body will not completely digest bile, and as a result, it can leave a little bit of stain, and it'll yellow things, just like you're describing in his vomit. If he's otherwise healthy and his blood work is normal, and you're not seeing other gastrointestinal signs, weight loss, loose stools, I think that there's no reason to continue to worry about that. And if the blood panels show no evidence of liver or pancreatic issues, that's something that'll just be a trend if it's a sometimes thing. So we are happy to say that's not a high concern question. Oh boy, it's looking like it's in my category right now, you guys. The next question is, my cat is 16 and she was hyperthyroid. Her nails are disappearing and nobody has a diagnosis. There's some pain associated with it, and she seems to have a good quality of life otherwise. They they say they'd ask anyway. So does anyone want to talk about nail stuff in a kitty cat?
Sure, I can take it. So I don't know if it's related to the hyperthyroidism or not. I think it would be probably worthwhile to get an X-ray of the feet. Which was there something in that question about like a metal shard in the toe? So maybe you've
Yes.
already done that. That's great. Sometimes issues with the nails just make us a little bit worried about the big C, which I'm sure your cat doesn't have. I'm not trying to make you panic. If you've had X-rays and there's not significant bone loss, in the toes, it's probably not related to that, but that's always a little bit of a red flag for me when I have a patient with, nails that are exfoliating easily or toenail loss. I always want to get an X-ray and make sure, and maybe a biopsy. I think it's hard to decide in a 16-year-old cat, is this worth the risk of sedation? But if there's pain and discomfort and the issue is ongoing, hasn't been resolved, I think it's within reason, and you could likely get it done safely if there's no other underlying metabolic issues. And that would probably be the way to get a significant answer. I'm not sure what the significance of the metal is. Unfortunately, we do find a lot of incidental like BBs and things in cats when X-rays are taken, and they're usually not the primary issue. They're usually not causing a problem. So that's not an uncommon thing that we find and do nothing about.
I'm trying to switch over. Sorry if that bug beeped you.
No worries. We can handle a doorbell sound.
Sorry.
Sorry.
Hang on.
Sorry.
Oh my gosh.
Okay, we were able to figure that. Rebecca, can you say goodbye to one of Dr. Wells? Okay, great. There you are. You're no longer cloned. Great. I like that. Thank you, Dr. O'Hearn. I do think some hyperthyroid cats get thicker nails, but I don't think they get weird. And what you're describing what is described in the question sounds a little different. So the next question is, how can we boost and support 18-year-olds' health and comfort in each of your specialties? Does anyone else? I can take that one. I'm trying, I promise not to monopolize here. But I think, and you're talking about 18-year-old kitties, I think a big part of it is making sure that you monitor their weight quickly or closely. I'm a big fan of weighing your cat at home if you can get a baby scale at least once a month, and make sure that you can tell if there's weight loss. Pay attention to how much they're eating, pay attention to how much they're drinking. Older kitty cats can get a little bit vocal. They'll sometimes yowl a little bit when they're older. And so when that happens, making sure they're not hyperthyroid or having other high blood pressure, other things that can happen with older cats. So basically kind of if you're into that kind of spreadsheet stuff, or just on the calendar once a month, writing your kitty's weight can really make a difference to just kind of see the beginnings of changes that you need to pay attention to. When you talk about boosting their health, good food, good engagement, and lots of TLC, I There are people that do a lot of herbal and diet support. I think that's an individual thing, so I don't usually make any recommendations regarding that.
Oh, can I add one thing onto that?
Please.
Because I love the seniors. I think one thing that often gets overlooked in senior cats, especially, is arthritis. A lot of senior cats have arthritis, and that can cause kind of a low degree of underlying pain that can affect their quality of life. So seeing your family vet for maybe like an arthritis evaluation could be reasonable. We have like lots of amazing tools to treat arthritis in cats available to us now.
Very good point. Thank you for bringing that up. And I should say, we kind of talked about everybody taking one question because we'll have some differing opinions, but everyone please jump in if you feel like you have anything to add. Since we come from such diverse backgrounds, it's nice to have everyone's input. So thank you, Dr. O'Hearn.
I would just add to have realistic conversations with yourself about when it's time to make end of life issues or to have those discussions with your veterinarians. 18 years old is a very old cat, and it's very easy for quality of life to be compromised, and we need to prepare ourselves for when that is happening, what it looks like when it's happening, because it's different for all of us, and how and when is it okay to make that decision, because we don't make that decision anywhere else in our lives, and always have a tendency to delay or get used to things as they're declining and make the decision more about what we want the decision to be, more so than what might actually be best for the pet.
Very well said. That quality of life thing is pretty important. And there is a good, you can look on the internet and find a quality of life scale that kind of objectively gives you numbers to grade that. And I would say I send that to many of my clients who are thinking about quality of life and comfort care.
Yeah, and as at-home euthanasia vet, I do quite a few. And I think this is a well-said thing in vet med, and that is that it's very rare that people feel like they chose the decision too early. And most people worry that they've waited too long when their cats or dogs are not well. And so I think that it's one of those things that people need to realize is, a lot of times we keep pets alive because we don't want to lose them, but that it's really important to look at their quality of life and make the decision based on how they are and how they're feeling. And so usually people don't wait. People don't do it too early. They wait too long is the typical scenario.
And we as veterinarians and pet owners struggle with the same thing. We do the same, it's a natural problem to fall into.
Absolutely.
And I think, which is why I always advise people in advance of the decline, you have to decide what does their quality of life look like, and then what are the components of the scenario where it has declined enough where it's okay, and then you have to hold yourself to that decision.
Yes, and it takes courage and love to say goodbye.
It is a decision made of love. It is nice that we can make this in the veterinary field.
Yeah,
absolutely.
Yeah.
Amen.
Dr. Wells, this is coming your way. What would you recommend for itching? Lots of conversations about prescribed Apoquel.
Yes.
Apoquel's not getting to the root of the problem, possible side effects.
Yeah.
Allergy and immune probiotic have lots of fillers, lots of ads on liquid collagen. Do any of these address the real issue? And how do you feel about that? Also, part of the question is, does the gut play a role? I can help you with that.
Yeah. So I tell people in general with itchy pets that there are 3 reasons why I should narrow this down. There are 3 reasons why animals, dogs and cats get allergies. And number 1 is fleas, hands down. Flea allergy is probably the most common thing we see. The second is food, which is a very complicated situation, isolating what they're allergic to in the diet, putting them on a hydrolyzed diet for a period of time to see if that helps. Sometimes that's really difficult. In my household, that would never work because my dog eats whatever my 4-year-old drops on the ground, and doing that would be hard. And then the third reason why dogs are allergic is every single other thing in the world that they could be allergic to, whether that's grasses or dust or laundry detergent. And dogs that fall into that category where it's not food and it's not fleas, there are some medications that are really helpful. And Apoquel is one of them. Cytopoint is the injection that I feel like is quite helpful. I use it in my own dog and I like it quite a bit. And then the newest, there's a couple new of these JAK inhibitors that the newest one on the market right now is called Zenrelia. And I've actually had some really good success with it. I've had people who've used Apoquel and used Cytopoint, didn't feel like they were working, and put them on Zenrelia, and people really like it. So it's a new one. There's new ones coming out now. There's another one on the market. I can't remember the name. So I think the important thing is, a healthy diet. I think making sure that they're on regular flea control, because fleas are such a problem. Even one little flea bite can trigger massive amounts of allergic reaction in dogs and cats. And then if those aren't working, then one of these medications that are available seem to be pretty helpful. The last resort, which I use still, is steroids, and sometimes we just have to use steroids and they work. But yeah, and then sorry. And then as far as gut goes, I would imagine there's got to be a component of that, and I will pass that on to you, Dr. Burtch.
Okay. We'll say hi to Sailor. So one of the things that is out there is this concept of the gut microbiome and the gut-skin axis. And so there's a lot of people who think that if you pay attention to the gut microbiome, you might help with some of the skin allergies. There's a lot of I would say controversy or early discoveries about that. And so when you think about changing diet and then you change the gut microbiome or gut inflammation, it's such a complex network in the immune system that it's really hard to say there's a direct correlation. But there are newer companies out there. Animal Biome is one of the companies that will do evaluation of the gut microflora, and then you can make some changes with medications to support the gut flora and and it may change itchiness. I don't think there's a straight line yet for us to say, oh, let's go to the gut microflora to fix your itchy dog. It's not that clear yet. So great. This is getting fun. So the next question would be mine, I think. Well, maybe not. Maybe this is a good one for Dr. O'Hearn. How do we know when it's important to see a specialist vet?
Ooh, okay. I think if you've gone to your vet, you've discussed a problem, you've done, maybe some basic workup with them, and you haven't gotten the answer or the diagnosis or the solution that you're after, it is never wrong to say, I'd like to be referred to a specialist. Having kind of been on, both sides, being a general practitioner and now working in a specialty hospital, I think sometimes as a general practitioner, we feel like there's a lot of pressure on us to solve the problem, and we don't want our clients to be disappointed in us. So, if you want to go see a specialist, it's never wrong to talk to your vet about that early on. But yeah, I would say, the extent probably of where your primary vet can take you is, blood work, x-rays. Maybe they have an ultrasonographer that can come in and do the ultrasound in their clinic. And then they may be kind of limited with diagnostics after that. Whereas, if you go see an internist or a specialist, they can potentially do things that are more advanced, like a CT or a scope that's typically not available at the general practitioner level. So I think, you go in for your appointment, you have the recommended diagnostics, no answer has come of that. The problem is still persisting, probably time to ask for a referral or at least discuss that option.
Yeah, and I'd say you're the main advocate for your pet. So if it feels right, it should be something. Even, people say to me, can I go to Davis? Yes, I always would love another opinion. So it's part of what our goal is, to work as a community to support the pets out there.
I mean,
Yeah, and I would like to add, we do partner with, with your family vet. So when your pet is in the ICU or your pet is, being seen by the internist, like we get on the phone at the end of the day and we call your family vet and let them know what's going on because they're going to take this case back and manage it long term. So it really is like a team approach. We're all there to just help your pet feel better or get better.
I would just want to add too, like as a general practitioner, that well, I rely heavily on Dr. Birch because I luckily get to work with her one day a week. But I think that it is very true, and that there are many cases and there's many patients that I see where I feel like I've done everything I can in my capacity, and that it's really important for us as vets, for our learning, and also just for your pet, is to seek a specialist because we learn, and it also, their insight into things that we can do, and ways we can treat your pet are vast, and so just being able to have that as a resource is just so important for us general practitioners who need help every once in a while figuring out what's going on, and what we can do to make your pet better. It's really important for us. We appreciate you, Dr. Birch.
I was just going to say that, in a perfect world, we would always take things to specialists, at least earlier in the process than we naturally do. In my opinion, I mean, I try and drive all of my clients to specialists whenever I possibly have the excuse to do so. Certainly, if there's anything real medical or surgical going on, especially with medicine, I'm not super strong with really involved medical conditions. And that's another point, is that every individual has a different skill set, right? But my point is that there's some basic tests that just about anybody can run. But after that, the specialists are going to know a lot more about what tests to run, how to run them properly, how to interpret them, in a way that I might waste your money if I'm trying to do that myself. So, um,
Thanks. Great answers, everyone. Yeah, and I would say if somebody asked me to spay or neuter a dog, it would probably take about 10 hours. So, there's a skill set, whereas, Dr. Jeff can do it in 10 minutes or less. And these are skill sets that we develop, and then we find our niche of interest and skill. And we want your pet to be with the person who's in their niche at the time. Great. Dr. Jeff, I'm going to give you this one, and I'm sure we'll all pipe up. When should behavior problems be addressed by a veterinarian instead of a trainer?
you picked me, and I'm essentially the opposite of a veterinary behaviorist. I've spent a lot of my career in the shelter environment where behavioral problems are huge and almost unmanageable, and a lot of shelter organizations invest unending resources in behavioral modification, in enrichment to avoid increasingly problematic behaviors. But from my experience, enrichment absolutely worthwhile. Aggression management modification, in my opinion, successful management of that sort of behavioral problem is, if you want, success is only achieved when you're focused on the behavioral management of the humans in that animal's life, right? There's not a lot of data on what pharmacologic interventions that we get to use as veterinarians that are actually effective to manage behaviors. And so we're often just trying things and trying different doses of those things. But my opinion is that always, if there's a real behavioral problem, if there is a medical way to manage it, it will only be successful in conjunction with behavioral efforts, primarily aimed at changing the behavior of the humans in the animal's life. In terms of when do you go to a behaviorist versus a veterinarian? I mean, if there's a real behavior problem, you're probably always going to have to utilize both. That'd be my perspective.
I think that's a good answer. And there are veterinary behavioralists. And
Not very many, though.
Not very many.
Not enough.
Yeah. UC Davis actually just okayed telehealth for behavior for, they've got this big behavior department and it was always having to go up there. And so they have just opened up to be able to do telehealth for behavioral issues. And I think that's one blessing of COVID is that there's a lot more telehealth and there many of the veterinary behaviorists will want to work with your general practitioner for medication modification.
I think Cornell is doing it for cat behavior too. As far as I've referred a few people that are doing telehealth with cat. That they have a big cat behavior program at Cornell, and I think they're doing telehealth for cats. Just so people know.
That's good to know. Great.
Yeah.
I think if you do feel like you need to work with a trainer, it never hurts to call your family vet and ask if they have a recommendation, because there are different methods used to train pets, and I think most veterinarians are in the school of using positive reinforcement and could probably direct you to those types of trainers, and that is going to be in line with what veterinary behavioralists are following as well. So not all dog trainers are created equal, and you can make some problems worse if you're using these very negative experience punishment based training methods.
Good. Yeah. So the next question is, how great is the risk of over vaccinating a pet in its lifetime? And are titers a worthwhile alternative? If so, how do they need to be performed?
I'll take it. As a shelter veterinarian, we lean heavily on vaccination because we deal with infectious disease at a volume and to a degree that nobody else does. And I worked at a shelter in Colorado that had an annual intake of 25,000 dogs and cats. So every year, 25,000 dogs and cats will go through, and they're all in the same room. So you got daycare issues and then spreading all sorts of anything. And they're coming from random sources and sometimes transferred in from other states. So we get to deal with every infectious disease, at least on our continent, and stress, right? So in that environment, we use vaccines very heavily, very frequently. And I saw less vaccine reactions in the shelter that I was at than I did when I was in general practice. And I think largely that's because in the shelter, we're not staring at the animal after the vaccines as intensely and with as much worry. But the vaccines reactions that do happen are self-limiting, mild. I am a believer in the safety of vaccines. And I'm unconcerned with the concept of over-vaccination in general. Now, I have had patients, usually they're smaller dogs, that will be triggered to have some autoimmune diseases by those vaccines. So certainly there's individual animals that have a sensitivity or a risk to either the type of vaccine, frequency of vaccination, where there are real significant medical concerns. But those are pretty rare on their own and can be minimized by reducing the number of vaccines you give on a particular day, spacing them out a little bit. But I think that over-vaccination in my mind is rarely an actual thing. I'm going on a limb there. I'll give you that. But the other side with the titers, titers are interesting, relevant, but will not change your legal responsibilities for rabies vaccination municipally. At the veterinary school I went to, my immunology professor, Ron Schultz, had done what my understanding was, the majority of lifetime immunity studies on vaccines, most of which were never published, but very clearly demonstrated that once a dog or a cat has a titer to the things in the vaccines that really matter the most, so rabies, distemper, parvovirus, panleukopenia virus, once they achieve a titer, it is protective for their entire life. But you can't know that they achieved that titer without running a titer test, which you have to run specific to each different virus or disease you're looking to. And titer testing is very expensive. And so just again, my whole background is very entwined with the cost of care. The cost of running titers for the things that matter for your dog or your cat is going to far exceed the cost of vaccinating them on whatever schedule your veterinarian probably recommends. So if you're worried about it and you're willing to invest a little bit of money to figure out what your pet is protected against, then sure, go ahead. But in general, I don't think it's going to change. In my opinion, boosters at whatever frequency we generally do, and that's variable depending on the vaccine you're talking about, are, I think, safe and unlikely to be a long-term concern for most dogs and cats.
Great. Any other input?
I want to touch quickly on vaccine site sarcomas in cats, because I would say that's like the major thing that I've seen as a problem with vaccines. And I am pro-vaccine. I'm not saying don't vaccinate your cats. Go vaccinate your cats. But when I started out in the field 20 years ago, it seemed like cats would potentially get cancerous tumors at the site where a lot of vaccines were given. So we started giving vaccines in specific locations and documenting that so we could see if there was a link. And it seems like some of the older rabies vaccines in cats would cause a tumor over the life of the cat at that site. So vaccines have come a long way since then. I think it used to be about 1 in 20,000 cats could develop one of these tumors. And now they have kind of cleaner vaccines with less adjuncts and ingredients in them specifically for cats. So if you're really concerned about vaccine issues in your pets and you're a cat owner, you may want to talk to your family vet and just ask them, like, is this a feline specific rabies vaccine? Because it tends to be these older rabies vaccines that are approved for dogs and cats that last a bit longer that we see more of these problems with. We try to give the vaccines very low on the leg so that if a tumor does form, amputation is an option, but that's a big undertaking. So just maybe asking about what type of vaccines your pet is receiving. Are they species specific? What is the risk of some sort of injection site reaction or tumor forming, I guess, is a worthwhile thing to ask. I think most primary vets are carrying these feline specific vaccines now, and they are called Pure Vax, and they're only for cats to reduce the incidence of these tumors.
Yeah, great thing to bring up. And from the internist perspective, I treat a lot of autoimmune disease. So if I see an animal that's got an autoimmune disease and it's been vaccinated within 3 months of that trigger, then I will. But it's my job to say to that pet owner, no vaccines for at least 2 years, because we don't know what the trigger was. And if it was a vaccine, then in that pet, I'm going to specify, let's not wake the sleeping dragon of the immune system if your little dog is already got a dragon immune system. But again, I think Dr. Sheff has a really good point. Is that worth putting? I mean, we can talk about polio in kids. Is that worth putting all the other dogs in the community at risk? So it's a tough question. It's a good one. Thank you. All right. What are your thoughts on using AI to evaluate a pet's medical issue at home? Does it make a difference if you use vet-specific AI like Vera AI, which Costco offers as a veterinary telehealth option? I didn't even know about that. There's a little bit of a pause. I think my answer is no one can underrate the physical exam. The physical exam is so important. There are so many things that can get identified that way. So I'm hesitant to encourage anyone to use that. I would say that it could help you decide, do you need to go to the vet, emergency room, or to your vet promptly? It might give you that fork in the road, but to have it give you recommendations for treatment at home, I'm hesitant to encourage that.
I think eventually the AI stuff is going to get better, but right now we're nowhere near a point where I would recommend relying on the answers you get from AI, regardless of what questions you're asking in the field or outside. So.
Yeah, and the result is very direct for your prompt. And if you're starting from, I'd like to know how to help my pet without the prompt of what does this disease look like, you could really be down a slippery slope of wrong information.
Yeah, I mean, I think all AI's got, a 20% inaccuracy rate. So what if you're getting wrong information? It's never like wrong to use that to generate some good questions to ask your vet when you have the visit. But if you're truly concerned about your pet, I probably would go see your family vet. And I have never heard of that veterinary specific AI program either. So, it's not, that information's not making it to the vet community that exists, which makes me wonder, like, how worthwhile is it really?
Yeah.
And I would just say not only AI, but Google in general, which we've all looked at Google, which non-AI Google, and the same thing applies to that, is that it, I think, can give you some information and direction, but there's a lot of false information on good old Google also.
Yeah, I agree. I'll have to look into that Vera AI. I hadn't heard of it before. So the next question is, if I accidentally lapse in giving heartworm prevention to my dog, is it safe to resume, or do I need to get a heartworm test first? I'm happy to take that one if you guys.
How long? My question would be, how long did you lapse for?
Yeah.
And what area do you live in? Because really, it's very dependent on if you live in Louisiana or in Capitola, would be my thought. And sorry, you can take on from there. But
no, that's exactly what I was going to say.
Yeah. We have that happen all the time in our practice, where people miss a month or two. I think it also depends on what medication they're getting, because some can be very harmful. And the idea is that if dogs contract heartworm disease in that short period where you've missed your prevention, and you then give the prevention, that there could be detrimental effects of the medication to give that to a heartworm positive dog. Santa Cruz in general is a low incidence heartworm county. And so I would say that usually if you miss a month or two, the likelihood is that you're safe, but always we recommend to retest before starting prevention again in our practice, regardless of where you are.
Yeah. And I agree with that. And the fact that it's a 4-month, in theory, it's 4 months before a mosquito bite to the microfilaria. So you could be safe in that time, but I don't think it's worth risking. And we don't have a lot of heartworm here, but in Louisiana, you wouldn't want to take that risk. Agreed. Or Texas. All right. My cat was recently diagnosed with pancreatitis. I give him Serenia if he's nauseated, but what else should I know about how to keep him as comfortable as possible? Middle-aged FIV positive and has been hardy and healthy until recently. That is a very good question, and I will take that. Kitty cat pancreatitis is it's a tough one because it's a little different than dogs. Dogs, we think it's triggered by a high-fat diet. Cats, we think it's an inflammatory change to the pancreas, and there's a lot of theories of what's going on there. Pain control and nausea control are pretty important, and sometimes we will actually use anti-inflammatories for cats. So your Serenia, just make sure you always have it on hand at home, and then maybe talk to your vet about some type of short-term pain control if there's a flare where your kitty cat seems uncomfortable. I don't think the FIV positive is necessarily directly related, but something that you put into the equation as you follow it over time. And just keep giving them lots of love.
Do you do anything with the diet in cats with chronic pancreatitis?
If I think there's underlying primary intestinal disease, then I will. Probably an easily digestible diet is a good idea. And it's not so much that they need a lower fat diet, but that higher fat can change gut motility. And if they've got inflammation right as the food's cruising past the pancreas, it can slow down motility. So sometimes we'll go with easily digestible, but I'm not as hung up on the on the specific diet with kitties. Oh, this is definitely not mine. How can I best keep 2 18-year-old litter mates happy, healthy, and engaged as indoor cats between leash walks outside? Oh, I see. There's multiple parts to it. We're sort of engaging in territorial challenges in a new, wonderful, and smaller home, and hoping for comfort and curiosity somehow to balance sharing the main room where most people come.
I can take this one because we see a lot of cats with stress-related urinary disease in the emergency room. So I feel like I have looked into this a little bit. So providing some enrichment to your primarily indoor cats would involve ensuring they have some sort of window perch where they can see outside. Some people will even put a bird feeder adjacent to the windows where the cats perch. So it's like a little cat TV for them. Cats are natural climbers. So, I mean, maybe at 18, they're not as spry as they used to be, but providing them, something they can comfortably climb and play on is reasonable. And then if there is a recent move and like a downsize, I'm a believer in the product Feel Away, which is spelled FELIWAY. And that is an over-the-counter product. You can purchase it overnight on Amazon, probably be in your mailbox the next day. And it is a pheromone-based product. So they have isolated the pheromone that cats generate to make themselves feel safe and comfortable. When a cat comes and rubs its face on you or rubs its face on something, it's putting that pheromone on there. It's actually called feline facial pheromone. So you can buy Feel Away, which is a laboratory-made version of that, and spray it in areas where the cats are having problems. Oh, my cat just jumped up here because he heard me talking about cats. And you can also get it as a plug-in, so it slowly releases it into the environment. And then there's a great website that the Ohio State Vet School has put together about how to keep indoor-only cats, happy and engaged, and how to meet their emotional and environmental needs. That probably is way more detailed than what I've given you here. So check that website out too. It's called the Ohio State Indoor Pet Initiative.
Great. And then Dr. Wells had mentioned the Cornell behavioral site. There's probably tips there too.
Yeah.
Yeah. So I sometimes making sure that they have a sanctuary. So if you decrease their shared space, try to make a place that one cat can go, the other is less likely to go. You can't always do that with cats because they're bossy pants sometimes, but it's worth a try. The next one is a very complex question, which I will do very short answers to. The question is Cushing's management and tracheal collapse management. So Cushing's disease is a oversecretion of cortisol, which is one of our stress hormones. It depends on what kind it is, but mostly there's oral medication to manage it. And you basically tell the adrenal glands, knock it off. You guys are making too much cortisol. And that should be very closely managed. Many general practitioners can do it with great comfort. Some are not comfortable about it. And if that's the case, then an internist would be a good place to take your dog. And then tracheal collapse management, the big thing for me is weight loss. Make sure that dog's not overweight. Overweight dogs have a lot more trouble keeping their collapsing tracheas open. Making sure there's not too much I recommend a HEPA filter, a high efficiency particulate air filter to decrease particulate air that might trigger the trachea. The more it collapses, the more mucus it makes. So calming the cough down and having a way to stop it is one of the other things I'll do for my patients with tracheal collapse. Anyone want to jump in?
I've been having really, really good success with mixing hydrocodone, so codeine, basically syrup. A lot of times we use the syrup and Serenia, which is meropitant. And there's been some, I think, recent research about using those two drugs in conjunction for tracheal collapse, or at least the coughing part that goes along with it. And I've had some really good success using those two medications together to help with the spasm, I think, that happens with the collapse. Have you used that yet, or?
Yes. Yeah. I think there's some dogs where Serenia really helps, and sometimes even better than hydrocodone, or the hydrocodone can sedate the dog so much that the owner gets concerned about quality of life. Sometimes it's allowable to have a zombie to stop the coughing for a day or two, but you don't want a zombie dog all the time. Yeah.
Sure.
which, sorry, I should qualify. Hydrocodone can sedate a dog, so that would
Right.
be the zombie comment. No, no
Yeah.
Hollywood movies there. So, great. And the next question is, what are your views on rapamycin for dogs and the dog aging project?
I had to look this up. I didn't even know what that was. I'm embarrassed to say. It looks like it's not FDA approved in the United States yet. So, probably not a lot of vets are going to feel super comfortable using that off label until it gets FDA approved. So I don't know if we're going to be seeing that anytime soon, but that was all I could really suss out when I looked it up.
Wow, that's impressive that you did your homework. I will say that one of the lectures in June at the American College of Veterinary and Internal Medicine some 5-day conference up in Seattle was the update from the Aging Project.
Ooh.
And it was the statistics look like they think it's going to be promising down the road, but they aren't all the numbers aren't crunched and it's not published yet. And the theory is that rapamycin changes the way you genetically age, and it can make a difference in the way your body therefore ages. I don't prescribe it. I have had clients that independently purchase it because you can find it on the internet. And there, if you go to that link, I think they even talk about the doses they use, but there is not science to back it. There's not statistical science to back it up that's been published that I know of at this point. Okay, then this is okay, now we've got a dog that's licking her bum. So a dog that licks her anal area frequently and aggressively, almost like it's itchy. How much is considered too much and when should it be cause for concern? The anal glands are regularly expressed 3 to 4 times a year. She's been tested for food allergies and she'll get some discoloration around there as well. And then, anyone jump on that? I'm talking too much.
Have they? I guess one thing would be topical therapy, making sure there's not a tumor in the anal gland, which I have recently seen a dog that was licking and licking and licking, and we ended up finding an actual mass in the anal gland. I use topical treatment back there quite a bit, and also I use e-collars quite a bit to just break the cycle of the itch. It seems like sometimes they lick and then it causes it to be worse, and so they lick more and then it causes it to be worse, and it becomes this cycle. And so sometimes just having an e-collar on for a couple of days and using topical therapy, topical steroids seem to help quite a bit. And I'm a big fan of a spray called Genesis, one of my favorite sprays for that area. But I think breaking the lick cycle, because I think it becomes a little bit of a habit for some dogs. So getting them to sort of forget about it for a few days, that the e-collar can be really helpful in those cases.
Yeah, and the other part of that question with, can we do anything prophylactically? I'm a big fan of adding fiber to the diet for trying to help the anal glands. It's a mechanical expression that can happen when a bowel movement goes by, and if you have a more bulky stool, sometimes that can solve the problem. There's non-prescription things like, I think it's called No Scoot, and other things, and most of the ingredients are psyllium, which is the equivalent to Metamucil. So that's another thing that you can try to see if you can help the anal glands self-solve. Make sure you talk to your veterinarian about that. Don't just do it just in case, and make sure that it's a veterinarian emptying the anal glands, not just a tech, because of what Dr. Wells just said. Any other input?
Well, I noticed they said they got tested for food allergies, which I think most vets would agree there's not really a valid test for food allergies other than trial and error. So if you didn't do a proper diet trial, which Dr. Wells alluded to earlier, that can be tough. You're only feeding this one prescription food for, 6 or 8 weeks. I guess you don't really know for sure that there's not a food allergic component. So if that is high on your suspicion list, you might want to talk to your vet about a diet trial.
Good point. Yeah, especially And the reddish brown discoloration, that is what we call porphyrins. It's a saliva staining type thing that can happen. All right, the next question. What are our options for emergency care after hours? Because there's sometimes a really long wait or they're being sent one place or another. This person's actually anxious to adopt another dog because that's been an issue. So
I can take that one. If you live locally, there's really only two places that are open 24 hours, and that is Blue Pearl in Monterey and Pacific Santa Cruz Vet Hospital in Santa Cruz. We are, we both struggle with case volume and things like that. So it's always recommended that you call ahead to make sure that we haven't had to close due to, too many clients waiting. But yes, both of those facilities are in theory open 24 hours. If your pet was critically ill, we would never turn you away. But if your pet is stable and, there are things that are dying and hit by car and things like that, we do use a triage process, and you may have to wait several hours or be triaged and found to be stable and turned away. But those are the two big ones in the community. If for some reason you couldn't get into either one of those places, I would be upset as the medical director of Blue Pearl Monterey. Let me know. But you could also drive over the hill, and I think probably Sage in Campbell and MedVet in Campbell might be your next closest options.
And Veg is about to open in Santa Cruz, another emergency.
In Capitola. When are we opening?
Capitola. No, I actually randomly drove by recently, and it looked like there was stuff in there, like it could be soon. But they are.
So there'll be 24 hours in there at the Capitola Mall too. And I mean, there is certainly enough to go around. Like, we're just so busy at night that we're happy to have another player in town.
Yes, we're happy they're coming.
Yeah. I'll try and keep it kind of quick myself, but I'd go a little bit further to say that going to an ER is always a frustrating experience, both on the veterinary and on the human side. I just 2 days after having a knee replacement surgery, sat in an urgent care for 6.5 hours, which you're really not supposed to. They don't give you some place to elevate your leg when you anyway. So it's a problem on both sides. I don't think we're ever going to have enough veterinary hospitals demographically ever again. So getting into your vet as fast as you want to and having that be smooth and timely may never be a reality. But it's going to be worse on the emergency side. There's always going to be less emergency practices. We're lucky to have any of them that we get, but they're you're paying them to be there 24 hours. So you got to expect to pay for that luxury. And they got a triage, right? Just because you're there doesn't mean your patient is more urgent than other ones, right? So I think if you're in a position where you need those answers after hours and you're going there, you need to have a level of patience that I think most humans even don't always have, right? So.
Yes, thank you for saying that, Dr. Jeff. Please be kind to the veterinary emergency staff. We're working very, very hard. I know you've had to wait a long time, but we're doing the best we can, and you would not believe the the things we see on an average night and the situations that we find ourselves in. So bring a book, bring a tablet, bring a snack. We always offer coffee and water, and we are working as fast as we can to get to your pet. So thank you for your patience and understanding.
And the next part of this question, are there any options for guinea pigs? Does Blue Pearl see some pocket pets?
We do. It depends. It's practitioner dependent. So always call and ask. We also have a good relationship with Avian and Exotic in Monterey. So sometimes we can actually call their vets after hours to get advice. But we do rely a little bit on relief veterinary care. So people that don't work full time for us and they may not be as comfortable. So, please, before you drive over, just call ahead so we can advise you whether we have a vet on staff that's comfortable with that or has a relationship with Avian and Exotics or not. So it's, I would say 60% of the time we're able to accommodate you, but it is vet by vet basis.
Okay. Yeah, that would scare me, truthfully.
So, yeah. I've got other Dr. Wells on speed dial, Avian and Exotics Dr. Wells. So,
that's great.
Not me.
So the next question, this is an interesting one, and I'm seeing more of it. Are vets refusing to see pets that are not fully vaccinated? You know, there's sometimes that people won't do that for medical reasons. And I have heard more and more that sometimes it's a corporate decision, but I'd love to hear from you guys whether you've heard that out there or where that.
We only require rabies in our practice. We don't require all the other vaccines, although we recommend them strongly. Dr. Hoban, who owns the practice, we only require rabies, and there are some cases where we don't even require that, depending on the health of the pet and what's going on. But we don't require all the other vaccines in cats or dogs, even though we recommend them.
I don't believe I have vaccine requirements at my practice. Definitely have recommendations and discussions with almost everyone, but I guess the only circumstance in which I would be leaning heavy on requiring is young dogs and cats coming into the hospital, especially like on a high volume surgery day or something like that. Like you're playing with fire if they've never had a vaccine. But I don't strictly have any requirements on that. But I can see scenarios in which that might come at a lot of practice.
And the experience I have with my clients telling me it tends to be a corporate dictate, which I can understand the intent to protect. Okay, we're getting close to the end of the hour. I would love to say we're going to get through all the questions, but I'm not sure we are, which maybe that means we do it again sometime in the future. But Dr. Jeff, this one is got your name on it. The question is, are tubal ligations or vasectomies available in order to allow hormones for normal physical development? And are vets supporting having these procedures later in dog's life?
Yeah, I mean, it's a little bit of a tricky answer. Certainly on the side of vasectomy type stuff in male dogs and cats. I'm sure there's vets that are doing it. I haven't done very many. I think I've only done two or three, whereas I've done whatever 150,000 spay and neuter surgeries otherwise, right? And so when I have people that really want to do that, we really have to have a discussion about why we would really want to have to do that, right? And in terms of the health of a male dog or cat, I haven't seen the data that really makes much of an argument that that difference will matter. Although, as a spay neuter veterinarian, I'm obviously on one end of the spectrum. I have a spay hook tattoo on my arm, right? Like, I'm not a vet. But I still will say, removing the hormones from the gonads, both of males and females, has dramatic impacts on overall physiology, overall life. And so it shouldn't surprise us if some of those impacts are good and some of those impacts are bad, right? And so gonad sparing spay and neuter procedures, it's an interesting discussion. And I think a lot of several universities, I spoke with some theriogenologists, so specialists in reproduction that are really looking at this, trying to do it. They'll do these surgical procedures where they're leaving the ovaries behind or they're leaving the testicles behind. I think I'm a little bit more concerned about leaving the ovaries behind for a few reasons. Almost not concerned about leaving the testicles behind. However, at least for me, I can neuter a cat in 10 seconds. I can neuter a dog in less than 1 minute. This is my surgical time, not my whole team's processing time, right? So I just want to make sure you really want me to spend the time it's going to take me to do a vasectomy, which is really going to move that 1 minute to 30 minutes, probably, right? Maybe longer, right? So, but yeah, I think there are probably, I don't know of any veterinarians that are doing gonad sparing spay and neuter stuff. I don't know any other veterinarian locally that does vasectomies. I've done a couple. I'm not excited about the discussion. I'm not convinced there's a lot of value, but we're starting to get some data that would speak to help us make a more informed answer to the question I just talked too much about.
No, I don't think it's too much. My comment would be if you have a male dog that has prostate problems or aggression problems, you're not going to solve any of them if you leave all the testosterone in the system.
Amen. Yeah.
So I think that's one of the things. What's your intent? Is it population control or is it behavior mod? And if you were trying to modify behavior, I have seen a lot of dogs go down an aggression path that they can't turn back on if we wait too long in a male aggressive dog. And so the benefits outweigh the risk, in my opinion. And I think we're going to probably wrap up then, because if we could really, there's a lot of questions and I would love to have gotten to all of them. I am impressed and happy that so many questions came across, and many of them were very complex. So thank you for submitting the questions, and it looks like this was popular enough that we might do it again, and we'll see if I can talk these people into helping you guys. I'm so grateful for you to be willing to do this, because it's a little bit of an on the spot moment, and I'm glad you were here to help.
I want to say a really, really big thank you to Dr. Fankhauser, Dr. O'Hearn, Dr. Wells, Dr. Burtch, of course. You guys are so busy. Your time is so valuable. And the collective resource we have in all of you is just incredible offering to the community. So thank you so much for making the time, for being here, for supporting BirchBark, and supporting everyone who watches the webinars and gets so much from being here. So I learned so much. My brain is exploding. It was absolutely invaluable, and can't wait to do the next one. Thank you so much for being here.
Yes, thank you all.
Thank you.